Musiku uno nemukana wamatipa. Tinokutendai nekutaura kunesi, ndosaka taapano. Mazvita henyu Mwari, taakusuma purogiramu yese pamberi penyu. Patinosvika pamberi pechigaro, munoona zvese, muchizwa zvese. Vanorwara, vanoshupika, vanofara, munovaona. Tinosuma mutauri, tinosuma zvese kune upenyu hwedu hwese nepurogiramu yese, itechisi wedu, tinomusuma kune. Kana wenyu ukarwiwa, ungotsvakawo kuzwa kutaura kwenyu, ungotsvakawo nyasha, ungotsvakawo upenyu hwakanaka. Kuda kuedzawo nepatinogona Mwari kuti tizosangana nemusha, ndosaka tiri pano. Tinosuma Mwari mutauri kechipiri muna matongo. Murangarire, hatigoni kumupa mutengo kana kumubhadhara, asi Mwari paakutora mukana wenguva yake, tenzi unoona henyu. Tinokutendai Jesu nekukudzai, musita nemubariri. Amen.
Amen. Mazvita mufundisi nekutipa munamato wekufora. Regai nditi pamusoro iyi kune mufundisi nemhuri yenyu, pamusoro iyi kuna CM, ndichiti zvepamusoro iyi kuna bosi wangu in absentia, mukuru weChristian Education. Regai nditi zvepamusoro iyi kune malay leaders edu. Taapano zvakare chechi yese, regai titi pamusoroyi. Tinoda kutenda Mwari nekusanganiswa zvakare pachikungano ino yekuti tidzidze zvakasiyana siyana kune vakanga varipo vachiatenda kubva musi weMande. Tanga tiri zvidzidzo zvakasiyana siyana izvo tanga tiri kudzidza. Nhasi tasanganiswa zvakare. Ndisingapedzi nguva, regai ndikumbire mufundisi zvakare vati introducewo kune mutauri wedu wanhasi. Thank you. Over to you again, mufundisi.
Ipai CM ni introduce pakati batikane necha.
Alright, thank you. CM kana muri pakasununguka tinokumbira kuti muti introduce kumutauri wedu.
Mazvita antimushunje nekutipawo nguva yekuti tigashire mutauri wedu wakakokwa mukati memanheru ano. Sorry ndiri pakabatikana hapaiti kuti ndiise video unfortunately. Asi regai vadikane tifare mukati memanheru ano kukwazisa Dr. Tendai Chikinje ndo vakakokwa kuuya kuzotaura kunesu netopic yerenal failure mukati memanheru ano. Vari pakasununguka ngativhurei mahwindo tese tichiti kuna Dr. Chikinje mauya. Uno muRepublic of Ireland. Mauya munhu waMwari, tiri kufara kuonai, tiri kuona matoisa video apo. Kumwe kwese uko mukakokwa musazoende nekuti kuno kuRepublic of Ireland UMC ndokwamunofarirwa, ndokwamunodiwa. Tiri kufara kuti muripo pakati pedu vadikani. Dr. Chikinje vapo pakati pedu. Pamwe pacho nokuti mutaura apo here uchimbotarisa asi patologa ini tabva tatoona zita ratonyorwa kudhara. Aiwa Mwari wakanaka. Nguva ino regai ndidzosere kuna antimushunje muzopa dhokota vaenderere mberi neprogram mazvita.
Thank you very much, Mukwenje CM. Tinokutendai nekuintroduce mutauri wedu. Mazvita, Mwari vakuitirei zvakanaka. Dr. Chikinje tinoda kukumhoresai nemufaro maita zvenyu nekuva pakati pedu. Hatisi kuda kundokumbopedza nguva kutorerai nguva yenyu yakakura, tinoda kudzidza. Over to you, kana unoti akutokusiyirai kwamuri. Thank you very much. Torai mukana wenyu mutidzidzise. Thank you.
Maita basa bate chigaro. Anongoti pamusoro kuna mufundisi Budio, pamusoro kutungamiriri wese weRepublic of Ireland. Ndinongokutendai nekunipawo mukana unoyu wekuti timbobatsirana kuita discussion yerenal failure. I hope ndiri kunzwika zvakanaka.
Bongo muri kunzwika zvakanaka. Thank you.
Okay, thank you. So ndoda kuti tingoita, I'm going to make a presentation first, and then I know kuti patakaita this topic yekuti renal failure, likely pane mubvunzo atanga tinayo, things which we wanted to understand. So I'm going to make the presentation. As I make the presentation, I hope kuti I'll be able to answer some, if not most, of the questions that I think about it address it. But kana kuri kuti at the end of the presentation panenge paine ma issues yekuti you feel like we also I need to discuss, please feel free to say, to share kuti can you please explain my issues akadai. So I also appreciate kuti panogona kunge paine vamwe vedu wekuti they are also in the health field, vanogona kuti tinozongobatsirana kana paine mama issues anenge achida kuzogoitwa as well. I'm leading the discussion, but koto kuti I'm the one anoziya kupfuura tese, so tinenge tizogobatsirana. So I'm just going to share my screen first. And scusi, wacho screen yangu muri kuiona here?
Hatisati takuiona.
Kuiona.
Hamusati makuiona. Okay, let me. Technology ndo painozombonetsa manje kana yaudai so. So
Take your time, Doctor. Pana paine ane muimbi, Doctor vachizama kushare screen pana, kana pana anokwanisa kutiimbira just for 2 minutes mazvita.
Mai mangu anditiimbirei. Mai mangu anditiimbirei.
about patutaura zverenal failure, there are a number of questions that would want to, I hope by the end of the discussion tinge answer my questions here. So which is what is renal disease, who is at risk of getting renal disease, and when does someone get tested, and also I said, yeah, why should I even care about renal disease? And how can we then prevent renal disease from happening? So the first thing is kidney itself. What is the role of the kidney? What is the kidney? So just like the body has a number of different organs in the body, the kidney is one of those organs that are needed in the body for the body to function on a day-to-day basis. And the kidney, the role of the kidney, because just like we eat, we breathe, we do all of that feeds into metabolism, and as the body is metabolizing, there's some waste that is generated, and that waste that is generated needs to come out in a way, and the way that the waste then comes out is through the kidneys. So this is the function of the kidney. And normally, through my kidneys, though there are some variants, one kidney or manogona otokara zvarwa vaine both kidneys on the same time on the same side, opposite mwana zvarwa vaine two kidneys akanenge akabatana. Those are variants of in terms of the structure, but the function basically in the same. I hope I'll be able to share this screen. In terms of the kidney function, I wanted to describe this function looking at wakamboita science. There's one my experiments that I remember back home, you would mix mvura nejecha, and then kana mix mvura nejecha, shines a filter, and then you use the filter using a beaker, and then that filter iyoyo yomva yasara yakabata all the waste, and then the clean water then goes into the container, which is more or less what the kidney does, to then filter all the blood, and then that filter paper is more like the kidney, which is then going to take away all the waste. So what is renal disease? Renal disease is when that function fails to happen. The kidney then fails to remove that waste, and then gradually we then have an accumulation of the waste. That's when you then say there is a problem with the kidneys. And as that is happening, there is another function of the kidney which then also fails to take place. Because the kidney is also just like remove all the toxins. In again a function of producing certain hormones like what we call erythropoietin. This is a hormone inenge yakakosha kuti ibatsire kuti red blood cells are created, and then pane hormones as well anobatsira kuti regulation ye blood pressure as well. So kana kuri kuti tinenge kuti munhu aita kidney disease, there's loss of that function yekuti the kidney is not able to remove the excess fluid, the excess toxins, and is not able to do the function or you produce some hormones and produce. In terms of the kidney disease, there are two general types that we talk about. One of the types is acute kidney disease, and then acute kidney injury, and then the other one is what you call chronic kidney disease. One wakawanda who might know about chronic kidney disease, the only difference is in terms of how it happens. You find not acute kidney disease, it happens much more quicker. It happens much more quicker than chronic kidney disease, which happens more slower. So with acute kidney disease, it's mostly what happens kana kuti munhu akaita severe dehydration. This could be related to munhu anogona kunge kurutsa ngachichaya, and then because of that rapid loss of fluid, zvinozokonzeresa kuti there's reduced flow of blood from kidneys, and then that's how the acute kidney injury happens. But what happens more often, what is more common, is then the chronic kidney disease, which is something that happens gradually. And chronic kidney disease, you find that happens more in vanenge BP, vanenge sugar, and then kunewa problems like prostate problems. They are also prone to having this problem with chronic kidney disease. And then there are some other medications as well, which if you are not careful, they can also affect the kidneys. These are common medications like ibuprofen, naproxen, doma medications anoshandiswa nevanhu vakawanda yekuti akashandiswa more than prescribed or akashandiswa too frequently or for a longer time, in the end they can then affect the kidney. course, some other people who are at risk by having congenital problems, like problems in kidney disease, which can run in the family. Those are people who are also prone at developing kidney disease. So how then do I know I have got kidney disease? That becomes the big question. So that how do I identify? So kidney disease, in terms of the symptoms, as we discuss, maybe we might discuss more leaning towards chronic kidney disease, because that's what is more common, and that is what is also it's more common, and when wakawanda we are predisposed to that because of various chronic illnesses. You find it in chronic kidney disease, a lot of people are diagnosed before they have any symptoms. They actually are asymptomatic at the time that they are diagnosed. Katori kashomege kuti munhu paanozowa diagnosed paane symptoms, of which by the time you start to show symptoms, you've lost more than 50% of your kidney function. You find that's why a person can actually survive with one kidney. One kidney is more than enough to sustain the body. Kana kurugutoti, it's you're now losing function. In fact, it should be about 70, if not 90%, and then you can say yes. Then start showing the symptoms. And the symptoms, they can be early symptoms, which are water retention. If I'm gonna water retention, in terms of going to the toilet, to go to the toilet less, and the amount of urine becomes less as well. And because you're not losing as much urine as you're supposed to, it ends up having accumulation, and then makumbo watanga kujimba. And then you also have symptoms like being fatigued, decreased ability to concentrate, loss of appetite, nausea, itchiness, and for kidney disease noetic, which is acute, you can also have discolored urine, or some describe it as Coca-Cola urine, which is that's more in the acute than in the chronic. And then as it progresses into further into the more chronic phase, because tinotanga tiri kuti tiri pamild or early stages, kana waino kune vanhu vakamboitwa diagnosis here, you find kuti GP anogona kutaura kuti this is stage 1, this is stage 2, or stage 3. Once you get to stage 4, stage 5, that becomes more of the severe impairment. And then stage 5 in your end stage, and then after renal replacement. So kanataushka kunana stage 4, stage 5, a lot of people then are prone to having heart problems, getting problems, confusion. Some people can get convulsions as well. So these are more of the complications as well, which is we progress to the severe disease, and then that's when the complications start to happen. Now the question is, in terms of the diagnosis, how and what stage is the diagnosis made? The hope and expectation is that we are not supposed to get a diagnosis symptoms. Ideally, we should make a diagnosis even before the symptoms start to show. This is in particular in the chronic kidney disease. Why we don't normally expect, or why we should not get to that ideally, is because for all these chronic health conditions, there's a monitoring that's supposed to be done almost annually, some even more than 2 or 3 times in a year. And these are done through the GPs mostly. And that involves some blood tests, urine tests. And as we do those tests, kana kuri kuti pakangoita anything chakunoita kuti there is a problem. Normally we talk about the GFR, or the filtration rate. kana kuri tikati yakudzika less than 60, that's when you then start saying that there is a problem, especially kana uri pasina ina problem. Then kana kuri totatozoti you have got kidney disease, we then need to continue monitoring to see if it's stable or if it's deteriorating. And once if it's stable, we just continue monitoring, making sure everything is fine, no symptoms, no worsening. And how to stabilize it becomes the other question. And stabilizing it, that would be so stabilizing it, like I said, these are people who have got chronic health conditions. So if you've got hypertension, the main thing is to make sure that the hypertension is well controlled, diabetes is well controlled, any chronic, any cardiac illnesses, or any chronic health conditions which require medication, inoita predisposed to kidney disease. All these people should actually have tests to make sure that it's under control and it's stable and it's not progressing. So the main important thing is to make sure that we go to the GP and have my routine tests. And as you have my routine tests, make sure that any intervention that needs to be done for all the other chronic conditions is done early and in time, so that we then don't get into the problem of CKD. But one thing that I've also seen, which people don't understand, is kuti munakanzi ane chronic kidney disease. Some then get to panic because the first thought is, I've got kidney disease. You think of okay, second I've been of dialysis, I got a kidney transplant. Kidney disease is just saying that the kidney function is not as good as you want it to be. But it's not like it's the end of the world, especially if it is in the early stages. Kidney disease can remain stable as long as we are making sure that all the other chronic conditions are under control, and it can remain stable without any problems at all. As you also try to stabilize it, also need to look at the mortality at high risk. We then also look at my risk factors. There are some risk factors which we can modify, and there are some risk factors which we cannot modify. My risk factors which we cannot modify, which we have nothing to do about, that is age. With advancing age, the kidney function inotanga kudzikira, filtration rate inotanga kudzikira. So the more the advancing age, the higher the risk of getting kidney disease. So there's nothing we can do about age. We can't stop the hands of time. But looking at what we can change, is things which are to do with diet and lifestyle modifications. One of the risk factors for kidney disease, which is a strong risk factor, is smoking. Smoking, it's worse if it is direct smoking, but it's more of living with someone who is smoking. Yes, it's different, but again, it's still a risk factor, which is the reason why even for a non-smoker, the encouragement is always don't smoke in a confined space, in a closed space. You need to smoke in a space and again a good aeration so that there is no risk to other people. And then the diet needs to be a healthy diet, low-fat diet. Once someone has been diagnosed with kidney disease, it also needs to become a low-salt diet, because a lot of salt would then cause a lot of strain on the kidneys. So it has to be a low-salt diet. Once someone has got kidney disease, you also need to avoid using medication, ibuprofen, naproxen. These are medication which can worsen the kidney function. So that needs to be reduced, if possible, to be eliminated. Of course, this has to be in discussion with the doctors or prescriber. But normally, choose or prescribe medication is because everything else would not have an option. But as long as there are other alternatives, normally we will consider all the other alternatives before we give all these medications. We should try as much as possible to avoid. Weight is also another thing which you also need to take note of, making sure that we manage the weight. Weight loss is going to be very important because with obesity, again, the risk is high, and the deterioration can also be much quicker. I cannot overemphasize the importance of fluids. Fluids anofana kumwiwa akawanda at least 2 liters per day. The exception is someone anenge ane advanced kidney disease, where we now need to limit the amount of fluids because we are trying to strain the kidney. But otherwise, we need to make sure that we try as much as possible to drink as much fluids as possible. The more fluids you drink, the better the kidneys. So yeah, in terms of risk modification, that's what we basically need to do. So this is mostly what I needed to do. This is more of a brief overview. But normally my preference as I do my teachings are very health related. I normally just like to do a brief overview and then focus the discussion more in terms of the questions or the misconceptions or things that you don't understand, so that at the end of the day, I focus more about what I want to understand, not necessarily what I have in my mind. So I'm hoping with this brief overview, I can open the floor to discussion, to questions, and then we can take it from there. Thank you. Mbato Chigaro.
Thank you very much, Dr. Mkwenje. Dr. Chikinje, sorry, presentation yenyu. Vadikani, the presentation mainzwa the overview. Now is time for questions. Ngatifunze mibvunzo kune vane zvanoda kunzwisisa. This is the time.
Pamusoro Mbato Chigaro.
Enderai mberi zvenyu mainhumba. Thank you.
Mazvita pamusoro mufundisi namai pamusoro Dr. Chikinje, thank you very much for the presentation. Inini ndikuda kubvunza pamafluids apa kuti inini mvura hainyanyi kundinakira, saka ndinonwa hangu green tea yangu isina sugar. Saka zviri inoita equivalent here ndikanwa hangu kana makapu angu akawanda egreen tea isina sugar as opposed to drinking water, kana kuti any fluids are good?
So yeah, this is a very good question. Of course, my clear fluids are going to be the most ideal. And in terms of health advice, that's the first thing, the clear fluids. The advantage of my clear fluids, they're good to all these added things, added salts, added sugars, and so forth, is just clear water. But kuna vanhu vakaita sana mai wangu wekuti they are not able to drink a lot of fluids. Then yes, drinking fluids in a way you can drink it. It's then better to drink 2 liters of juice rather than no water at all. So clear fluids are better. But for some people, my clear fluids are not going to happen. Yes, my juices can then be something. But when you talk about juices, these are not carbonated drinks. My drinks Fanta and so forth. So we then need to try and make sure with my fluids they become 100%. They will be fine. My juices, the carbonated drinks are the ones that should not be very good because they've got a lot of caffeine and then they can also then cause other issues. So that's what would be more ideal. Can I find anything else?
pamusoro Dr. Chikinje mazita enyu neteaching yakanaka. Ini ndoda kungobvunzawo kuti ndakambonzwawo about renal cysts kuti is it something that should worry someone kana muchimbonzi kana kuti aita 1 centimeter ombodzokera onzi 1 maviri but what we are not sure was, is it something that people should be worried about? Kana ari renal cysts.
Okay, thank you. So in terms of my cysts, there are different kind of cysts. Pane mango ma cysts ekuti let's say kuti munhu aenda for an ultrasound scan, angachirwadzwa nedumbu for some other reason, and then we do an ultrasound scan, and then incidentally we find there is a renal cyst. They mostly with they actually even on it for scan to the simple renal cyst. And normally these are small cysts, 1 centimeter area. So these cysts, these are not something of concern. You find that the body, some cells die off, and then once they die off, the body reabsorbs them, and then it just deals with that by itself. So there are some times where, let's say we do the scan at the time you're told that process is still happening. Some cells are in the process of dying off and being replaced, and those during that process are not going to get more of a fluid, and then that becomes a simple cyst. And this cyst is not a cyst which is will resolve maybe after a couple of months without any intervention, and normally they don't cause any pain or discomfort. So my simple cyst, there is no need to do any interventions. But kune mango ma cyst ekuti like let's say we do a scan on the cyst or multiple cysts. So if there are multiple cysts, then it becomes more of a worry. And normally my cysts are not going to add multiple. At times it can be really hereditary. Kana kurutoti your parents or your grandparents have had such a problem, then the risk can be high. You also have a kidney cyst. And such cysts then also comes with different kind of possible complications as well. Renal failure being one of the possible complications. And as a result of those cysts, they become hypertensive. I think hypertension, more than 90% of hypertension is essential hypertension without any identifiable cause. But there are a few people who hypertension is linked to a specific cause. One of the possible causes of what secondary hypertension in kidney cyst. And kanakuru munhu anenge aine kidney cyst, polycystic kidneys. Then there's also need close monitoring because my heart disease as well, or even problems with my brain aneurysms as well. So it's going to be simple. Mama sister and is just because we are just discussing about the kidney cyst, but otherwise the most common cysts that would come across are going to be the simple cysts. Those simple cysts, there's no need to worry about those.
Maswita.
Hapachina mubvunzo here vadikani?
Pamusoro mubati wechigaro, pamusoro mufundisi namai all protocols observed. Dr. Chikinje, tinoda kutendai zvakanyanya nedzidziso yepamusoro-soro. Shuwa tanzwa tiri kubetsereka. Pane pamataura pamacauses ekidney damage kana kuti how vanhu vane diabetes are at risk of getting acute kidney damage. Ndaidisa kwazvo kuti kana muchikwanisa munyatsodzokorora pemetformin kuti inokwanisa sei kukonzera acute kidney injury, because toziva kuti vanhu vakawanda vane madiabetes nezvikafu zvedu zvemunomu, and some people are taking metformin and inonyanya kuve inokonzera kidney diseases. If you can explain further on that one, Mazvita.
Okay, thank you.
Sorry.
There is a bit of back here.
Okay. So thank you for the question. Yeah, there are some medications that it's not gonna control a problem. And metformin, yes, metformin and the kidneys. There is a time where we do not want metformin. Not good metformin, there's a direct cause of kidney impairment, which is as a result of metformin. But what then happens for someone anenge diabetic? I want to share this screen so that maybe I can explain this better. Maybe I don't know. Yeah. So I'm just going to share this. Okay, so before I go to issue maybe it's not on the battery as I'm trying to explain. So pane pandambotsanangura paya kuti the kidney works as a filter. So as the kidney is working as a filter, this is the diagram that I wanted to describe. That we've got our blood which is coming into the kidney, and this kidney is then going to filter off all the toxins that are produced through metabolism, and then these are then supposed to then come out through the urine. There are a number of things which can then cause problems with this filter, which is the kidney. And diabetes in itself, any medication, diabetes in itself is going to cause problems in the kidney, especially if it is not controlled. If it's under control, then that's good. But if it is not well controlled, then it has problems. The best way to make sure that doesn't happen is just to make sure that for someone who's on treatment, we continue all the medications, including metformin. We just make sure we continue the medication. But you also notice that for any diabetes, part of the monitoring is to then do a urine test at least every year. And on the urine test, actually, proteins are urine. Because kana kuri kuti kidney inenge isashande zvakanaka, kidney starts to lose protein which is not supposed to be lost in the kidney, and then that starts to cause more problems. Metformin in itself, it does not have specifically direct effect on the kidneys, but one of the complications not metformin is not acidosis. Kidney in itself can also cause acidosis as well. So for someone who has a problem, acute kidney injury, would want to avoid certain medications during that acute phase. And metformin is one of the medications that has lost a lot of fluids, now at acute kidney injury. We know there are going to be a lot of problems that can happen, and we don't want to cause any other complications as a result of the medications that can change. So for such a patient, the advice would be to stop the metformin until everything is settled, and then when everything is settled, you can then go back on metformin, because the combination of kidney disease and metformin gonna cause some acidosis. But not to say metformin in itself specifically is going to cause kidney disease. I hope ndakwanisa kutsanangura.
Aiwa, matsanangura zvakanaka. Thank you very much.
Ini ndawa, please ask me. 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 So ndinoziva kunyarara kuchireva zvinhu 2. It's either ndagona kutsanangura zvakanyanyisa zvokuti vanhu vambova ndabva ndapindura all the questions, or I've not been able to get through to my audience. I'm going to believe it's an issue yekuti I've been able to explain and I've been able to go through if there were any questions that were there. And I'm happy there are some other questions that we are and we've gone through that. Kidney disease, it's a topic which can be broad, and it's a topic interlinked with other chronic illnesses. We can't really separate kidney disease from other chronic illnesses. We can't separate it from other medications. That's why I wanted just to do a brief overview and then focus more of what clarifications we may need to do. Outside of this meeting, kana kuri kutoti some other questions would have come. You are always free to talk to me, to share with me. Ndiri mwana wenyu, I'm there at your disposal at any time.
Thank you very much. Kudairawo kwangu kuti kunyarara kureva kupesana nekunzwisisa amanyatsotsanangura. Pachina chine mubvunzo.
Yeah, a bit faint, but ndiri kukunzwai.
Okay, mambobata nyaya dzediet.
Yep.
Usually diet must happen. It's something that are really very
Yeah. Sorry, it's irikuitaka kubreak. I don't know if it's possible. Maybe kana kungoita type as a chat because I cannot hear you clearly. I don't know kana amwaru nyatsokunzwai.
Inini muri kundinzwa here?
I can hear you.
Okay, regai vataure microphone. Vanga vachiti andinonyatsonzwa vanga vachitaura nyaya yediet yemaZimbabweans. And sometimes inotikonzera ma-issues nezvatinodya usually on a day-to-day basis. Pane ma-hints amongatipe here panyaya ye-typical Zimbabwean diet here. Ngabatsire to avoid renal failure.
Okay. Thank you. That's a very important issue, which I wouldn't say Zimbabweans specifically, but I would say set up of being in Zimbabwe. That's where I've noticed it. In terms of diet itself, I don't have a lot of problem with the diet. From my experience working back home in Zim, the most biggest problem that I've seen yatinoita kuZim ndeyekuti kana kuri kuti ndikarwara nemusoro, ndikarwara nemudumbu, there are a lot of doctors who are there. We have got a lot of different information, and some are actually operating legally. So tinopanana maadvice akasiyana siyana ekuti ukaita mudumbu shandisa herb yakati, ukarwara nemusoro shandisa herb yakati. And I've actually seen one young man akarwara nemusoro. It was not something serious, but akapiwa advice yekuti ashandise maherbs. The first time that guy came to the hospital was not because of the headache. The headache was minor. There was no need to come to the hospital. But by the time he came to the hospital, he had a severe acute kidney injury because of my herbs Shandisa. So if it's an issue of diet in terms of day-to-day, yes, of course, there are issues which you can improve. A lot of diet, one especially kana kuri kutoti in an African setup, not just Zimbabwean African setup. You find with a diet there's a lot of carbs, more than 50% of the portion carbs. Yet 50% is supposed to be vegetables, and then carbs are found at just 25%. And also there are some people who go to, in terms of the diet, there's a lot of cholesterol. In terms of the fruits, a lot of people so yes, in terms of diet, there is quite some things which we can improve in terms of being on a good diet. Chimwe chinoaffecta issues the diet back home is also in terms of availability and affordability. It might be something which we may take for granted whilst we are on this side of the world, but it's not as easy for a lot of people back home just being on a good balanced diet. But the problem in it on people they end up using different kinds of herbs. And these herbs, but the herbs they are not controlled. Yes, they might work. It's not about all these medications, they come from the herbs. But once it's a drug, then it's controlled. But if it's a herb, the dosage is not controlled, the form is not controlled. And then when it's then put into their body, when it comes to the kidney, it can have devastating effects on the kidney. It starts with a simple headache, ends with renal failure, and then something else. So my concern is more about the herbs than the diet itself. Handiziwo kana ndakwanisa kupindura kana kuti ndajenga mubvunzo.
Aiwa, mapindura zvakanaka. Yes.
Vadikani, thank you very much nekutivirira kuti tidzidze. Tinotenda Mwari nevapa vatisvitsa. Kana pasisina mubvunzo, regai nditende Dr. Chikinje nepresent yavari pane chidzidzo. Vane vakavhara mahwindo, ngatimbovhurai mahwindo titende Dr. Chikinje nechidzidzo changa chiri pamberi. Ngativhurei mahwindo adikani.
Mazvita mwana wangu
Mazvita,
mazvita Dr.
Thank you so much.
Mazvita.
Thank
mwana
you
wangu
very
yeye.
Tinotenda Mwari, tinotenda chokwadi nechidzidzo. Murambe muri mudhuze, tirambe tingokushandisai muchitipa zvidzidzo zvakawanda. Ini zvangu ndadzidza chokwadi. Dr. Chikinje vanyatsotaura the what, kuti what is a kidney failure, vakadzika vakaita who is at risk, when to test and why, how to prevent. I think questions vabva vanyatsa kuma-answer ese zvakanaka, zvokutoti mibvunzo yabva yazoita mishoma. Atinotenda Mwari. Ndisingachapedzi nguva, regai ndipe nguva kune ve-CM, then after CM toendesa kune magosa, then after that tobva tadzosera nguva kuna mufundisi. Kana vari pakasununguka vobva vatipa closing prayer vachititendera mupresenter wedu. So CM
mazvita litegist wedu Aunty Julie nekutitungamirira rusando rwanhasi zvakanaka. Thank you so much. Mwari vakuitire zvakanaka. Thank you so much Dr. Chikinje. Aiwa, matidzidzisa ende mataura zvinonzwisisika. Isu vamwe tistori mumedical field, tikatobvunzwawo mangwana netakutogona kutsanangura topic yamauya nayo muzuva ranhasi. Thank you so much. Mutitenderewo maine vana vakuregedzai muchiuya kuno kuRepublic of Ireland kuzotidzidzisa. Mukati memanheru anoregai tichibva tangotora mukana unovadikani kutendai mese neChristian Education Week yedu yatiri kuona kuti takatanga zvakanaka and taakuda kuzoipedzisa zvakanaka muzuva remangwana. Pamwe pacho hatizooni nguva yekutenda zvakakwana asi regai titende zvakanyanya baba Peter Mutamiri, our nurturing coordinator, anga achishanda neChristian education kuti svondo redu ringe riri svondo rakarongeka, svondo rine zvidzidzo zvakapfuma. Tichitenda Christian education chairperson wedu weBandumba naassociate wavo wataona ari litegist muzuva ranhasi antimushunje. KuChristian education ikoko zvakare kwaitwa mameeting vanhu vachironga nezvesvondo rino, saka regai titende mamembers zvakare ari ikoko. Tina mai Dingo, tina mai Mawiwi, tina mai Parenyatwa. Thank you so much vadikani, makagona makatigonera nekutirongera dapura hunanzva mukati mesvondo rino. Totenda zvakare vakanga vari malitegist edu mukati mesvondo rino. Tina mai Darikwa, mai Nyandari, mai Gwasira, mai Mangwandi. Toda kukutendai vasikana nekuramba makamira kuitira kuti svondo redu rifambe zvakanaka. Tichitenda zvakare vatauri vedu vakatanga musi weWednesday, Evangelist Mungure, vachiteerwa naDr. Chagumaira, vachiteerwa naGogo Hungwe, nhasi tatina Dr. Chikinje. Toda kuramba tichivatenda vatauri vedu, tichinamatira kuti Mwari acharamba achivapa ruzivo rwekuzodzoka kuno kuRepublic of Ireland, vachiramba vachizotidzidzisa. Tine makwaya akanga ari pakati pedu mukati mesvondo rino. Toda kutenda mai Ndumba, toda kutenda mai Mangwandi, toda kutenda CYM yedu yakamirirwa naJosi naLili Stole naTanesha Murape. Toda kukutendai zvakanyanya vadikani. Takanga tine maBible readers ana mai Guma netimu makatigonera vasikana. Thank you so much. Tichitenda zvakare media team yedu Mr. Tirivavi, baba Nyandari netimu yavo yose vachibatsirwawo nababa Murape wangu vasisiri member yemedia team asi vari kuramba vachimira vachibatsira. Thank you so much media team nekutivhurira madhoo nekutirekodhera maprograms mukati mesvondo rino kuti vanga vari kumabasa vazowanawo chekuteerera pavanenge vafree. Tichipedzisira nekutenda magosa edu for all the support. Tichitenda pastor namai nekutigaidha mune zvese zvatanga tiri kuita, nekuzvitenda isusu vadikani tese takadai as a church. Toda kungozvitenda kuti tese takaisa nguva parutivi kuti tiuye kuzodzidza, nekuti zvidzidzo zvacho zvikashaya vari kudzidza hazvizobudi zvakanaka. Saka toda kungoti kutendai mese vadikani kuti makazviita kutanga musi weTuesday muri pano. Mangwana tozosangana kuchechi tichizopendera svondo redu. Ndine zviziviso zvishoma zvakare from CM tese. I think tiri kuziva kuti musi wa16 Sunday next week inherera Sunday. Masection leaders we know kuti vakutotanga kucollecta mari dzenherera mumasections mavo. Saka vadikani tiri kuramba tiri kungokurudzirwa kuti ane 5 euro, ane euro, ane 100 euro ngatiise muchurch account mari dzedu dzenherera. Tonyoresa mazita edu kumasection leaders edu. Tichida kutotenda CYM, ndakaona kugrupu kwavo vari kucollectawo eCYM. Toda kubatsirawo nherera dziri kuZimbabwe. Chinhu chinofadza and chinhu chinodadisa. Thank you so much CYM coordinators. Then zvakare musi weTuesday next week musi wa11 at 8:30 p.m. macommittees ese ari under CM tiri kukumbirwa kuti tisangane for our objectives meeting patiri kuzodiscussa nekuwirirana maobjectives ese as CM globally. Tine masubcommittees about 16 at the moment ari under CM. So mamembers macommittee chairpersons tese nemacoordinators tiri kukumbiriswa vadikani musi weTuesday tisangane na8:30 p.m. nekuti after that tinenge takuzoenda kuchurch council and ikoko tiri kutarisirwa kuti tizoenda tiine one voice tadiscussa zvinhu zvedu tawirirana nemabhajeti zvese. Saka musangano wakakosha tese tizopinda. Thank you so much. Regai ndisire nguva ino kumagosa. Handizivi kuti vazopinda here magosa edu ambofamba mukati mezuva ranhasi. Magosa kana asipo tochisira nguva ino kuna mufundisi for closing remarks. Mazvita, over to you Pastor Budio.
Mazvita, toda kutenda Mwari nemukana waatipa wekudzidza zvedi tadzidza. Ndokukutendai Dr. Chikinje the love you have. Munoziva kuti after learning so much muna doctor ane nguva nevanhu even the way they talk and all those things. Wow, to pay attention yonoda. But kune the way you talk munoratidza chido pamwe nerudo newabanzi wenyu zvinopangidza kuti munhu akazanga ndiMwari. So ndokutendai. It's a rare breed, it's a rare character inooneka kuita zvinoita izvi. So rare. Tinongoona kuti mune chido nevanhu. So thank you so much. Wakaona mava kuti doctor in the house, mava kuti pana ane mubvunzo here une mukana wekubvunza chikomborero chinoshamisa. Ndofunga paROI tine chikomborero kuti aitirwa zvakanaka ndiMwari. Pamanga muri kungotaura ndangoona the love of God to me. NdiMwari iri wandigadzirawo mukana wekuonawo dhokta achitaura kunesu, achitaurawo nechechi yedu, achipa mukana wekuti ngatibvunze mibvunzo zvakanaka zvinozwisisika. So ndaona rudo, ndaona Mwari. Munamato wangu ngewekuti Mwari aramba achikuchengetai, achikupai good health muupenyu hwenyu nemhuri yenyu. Chechi yepaROI shuwa taitirwa zvakanaka. Kana dai taimboda kubvunza kuti mablessings aMwari ari kupi, nhasi taitirwa chikomborero chekuona dhokta ngari pakati pedu achitidzidzisa. Soko raMwari kuna John wechitatu chapter 1 verse 2 inoti, Beloved, I pray that all may go well with you and that you may be in good health as it goes well with your soul. Psalm 147 anoti, He heals the broken-hearted and binds up their wounds. Mwari ndiye anotirapa, Mwari ndiye anotipa utano, Mwari anoshiyira utano kunesu, regai tikashire nyasha. Baba patakura, tinokumbira nyasha kutembera Jesu Kristu. Rudo rwenyu Mwari runotichengeta, rudo rwenyu runotipa advice, rudo rwenyu runotipa utano. Irwo Mwari, Jehovha Rafa, the Lord who heals us. Ngazvigare nesu, zvitikomborere, zvitipe utano. Baba tinokutendai, komborerai dhokta, komborerai timu yese yanga iri pano. Tinokutendai Jesu, patinokukudzai. Mbiri nerukudzo zvinodzoka kunemi muzita raBaba neMwanakomana neMweya Mutsvene. Amen.
Amen. Mazvita mufundisi.
Mazvita chidzidzo
vadikani, thank you.
chinokombererwa mwana chechi namufundisi.
Mazvita.
Thank
Good night.
you. Good night.
Mazvita. Tendai umhorese vangu uko.